Hi guys, the hair's growing back due to not being on doxycycline all my life, but we're not here about that. I want to speak a little bit about Haemophilus influenza. I will be going through, some kind of internet briefing because I'm not 100% clued up on it, but I'm clued up to the point I can tell you medications to fight it. So we'll go from there. So I might refer back to what it says on the internet, but mainly I'll be talking about in this section how to fight it and what medical professions will offer you, and I'll tell you what I know about Haemophilus influenza as well. Okay, so we'll wait until we get a few viewers and we'll crack on. I don't want to natter on straight away, because sometimes we'll get a viewer and I feel like I have to start all over again. So I'll go into the two minute mark, or if no one's here, I just sort of start off, and they can follow back at a later date and catch up. We can call it catch up TV. Right, I'm just going to crack on, and I'm going to start off with Haemophilus influenza. It is the most common chest bug. Oh, okay, it doesn't just grow in the chest, it can grow in the ears, the skin, blah blah blah, but it's the most common chest bug. Therefore, when someone presents themselves to GP and says, I feel like I've got a chest infection, the first protocol is to check the chest, blood pressure, heart rate if they want to, and temperature, these kinds of things. And if these all suggest that there's an infection based on what patient said, then the first protocol will be a prescription of an antibiotic called amoxicillin, and it will be usually a 250 milligram dose to a 500 milligram dose, and that will be given for 7 days. Okay, so that is the first protocol of fighting Haemophilus influenza. Most people will have it even if they don't have bronchiectasis, so if they present themselves to a GP, they will be given this antibiotic. What will happen then is, if you become resistant to amoxicillin, so you keep going to your GP, but your GP is looking back on records and sees that he's given you amoxicillin 5-6 times, you might think it's not working. He can do one or two things. He can either put you on doxycycline, or he could request a sample. So even though you don't have bronchiectasis, if he's a good GP, he should suggest that, say your name's J. Smith. J. Smith, we see you've been in clinic 5 times now. We've prescribed you amoxicillin countless times. Would you mind spitting in a sample pot, and we'll send it out. Whilst we'll send it out, we'll change the amoxicillin to doxycycline base. Doxycycline is a little bit more potent than the amoxicillin. It's quite a strong antibiotic as well, and not many bugs are resistant to it. With you never taking doxycycline before, you should have good success with this antibiotic. Take this for a week. If you're not feeling better, come and see me, and we'll talk about the results and further treatment if we need to. So then if patient goes home, takes the medication, still doesn't feel well, goes to GP, GP says, yeah, we can see you are still growing Haemophilus influenza. We have given you a week of doxycycline. You seem not to be responding. What we're going to do now is we're going to give you 2 weeks of doxycycline. Patient goes home, takes 2 weeks of doxycycline, starts relapsing, doesn't feel well. Again, doctor does the protocol of sending the sample out, and then sample comes back, you still have Haemophilus influenza. Doctor's scratching his head thinking, well, we've tried him with amoxicillin, that should have killed it, didn't kill it. We've now tried him, or tried her, with doxycycline, and we've also given 2 weeks of this antibiotic, and it's still not fighting it. That suggests Haemophilus influenza has probably colonised in the body. Because it's colonised in the body, it makes it so hard to get rid of it. So giving amoxicillin again would be pointless. Giving doxycycline again would be pointless. So then we have to look at a wider range of antibiotics that can fight Haemophilus influenza. We're talking about something called cocloxiclav, also known as augmentin. And how this antibiotic works is very similar to the amoxicillin. The only difference in it has 125 milligrams of something called calvic acid, I think, and that calvic acid inside this augmentin, I'm going to call it, is something that is designed to stop the bug coming back. Okay, where the amoxicillin doesn't have this in, the colchicave, that's harder to say, or the augmentin, has this. So basically, it's just amoxicillin, 500 milligrams, but it has the 125 milligrams that will stop the bug coming back. Now, if the doctor thinks we'll give you 1 week, come back, see how you go. If this doesn't kill it, okay, guys, if this augmentin, I'm going to stick with augmentin, it's known as 2, okay, it's just easy to say augmentin. If this doesn't fight it, he may put you on a 6 to 8 week course of augmentin. It's a very, very good antibiotic. People with bronchiectasis, without bronchiectasis, have probably never heard of it. Okay, it's very good. If you're still not feeling better, then you're not really left with many other options to fight Haemophilus influenza. You're left with 2, as far as I am aware, and that would be either IV, which is intravenous amoxicillin, which would be done every 3 to 4 months, either in hospital or by home IV team coming out. So that's another option. The second option is something I've trialled myself, which is a nebulized antibiotic, which is amoxicillin. I can show you that if you give me a brief second. So you can be put on this. I'm sure if I've not got it, it doesn't matter. I thought I had it. So these are the only options regarding fighting this bug. As far as I'm aware, I believe I'm colonised with it. It's my #1 bug, so I know it a lot. This is what you will be given. You will be given something that looks like this. It's amoxicillin. Okay, this is the same stuff they use intravenously. You will make this up with water for injections. You will shake this. You will draw it out and you'll put it in a mouthpiece. You'll have a pipe that goes out the window for ventilation purposes, and it takes about 15 minutes. Okay, guys, it stinks your house out. You've got to do it twice a day, and it's long-winded. So these are the little steps in fighting influenza. Also, before I go, I'm going to touch on this last topic, well, or the last thing on the topic, should I say, and I've just fell upon it. It says Haemophilus influenza is a known bug in diseases like bronchiectasis, COPD, but not only that, it also is a cause of pneumonia. And I've only just found out now, whilst I'm going live to you, and it's ticking all the boxes, because I'm someone who's had pneumonia, as far as I know, diagnosed with it maybe 5-6 times in my life. With me colonising this Haemophilus influenza makes sense why I'm always having a relapse every now and then of the pneumonia. So Haemophilus influenza bronchiectasis is linked to pneumonia, so keep your eyes on that. If you grow Haemophilus influenza a lot in your sample pot, I suggest you ask for the pneumococcal injection. For me, I don't believe in having a flu injection, but that's my personal preferences, and I tell you why. I can only base it on why I disagree with the flu injection. Okay, something's just come into the news not so long ago, so I can talk on that, why I disagree with it. But before I seen the news about what happened this week, I disagree with it because if your body has fought flu off in the past, I'm a 32-year-old man, and I remember about 10 years ago I fought the flu off, and I'm not going to lie to you, I felt like I was dying. My brother recalls coming down, because I was sleeping on the couch at the time, and seeing me dead pale, my face was pale, my breathing was shallow, and he had to say, are you okay, you okay? But if I didn't fight that flu right at that time, my immune system wouldn't be able to fight it, right? So I'm not going to take a flu injection for 2 reasons. One, you can't cure the flu, okay? You cannot have a vaccination that cures next year's flu. That's like you giving me the lottery numbers for next week. It's not going to happen. 2, I believe it does more harm than good. You keep getting these vaccines, what it does, it makes your defence mechanisms weaker, that if you do catch the flu, you're going to pay for it, in my opinion. So therefore, I don't have it. touching on this week what happened in the paper, on the news, in the British horse racing column, there was many horse racing tracks abandoned because 3 horses from a certain stable tested positive to influenza. Not Haemophilus influenza, the flu. People were scratching their head. How have these horses from very, very reputable stables who have been vaccinated against the flu contracted the very same flu? If that doesn't speak volumes, guys, that you cannot vaccinate against the flu, whether it's in animals or people, I don't know what will. Anyway, guys, I hope I've helped you out. See you later.